Assalamu alaikum dear student, welcome to my channel Medical Lecture in Mnemonic. Today I am going to talk about a very important topic which is called gyne and ob history. But before gyne and ob history, there are certain terminology used in the gyne and obstetric history. So this terminology should be known to each doctor and each medical student. So the first thing is the gynecology and obstetrics. What is gynecology and what is obstetrics? These are the two major branches of the medicine. In gynecology, we mainly study the health of reproductive system of a female, and obstetrics, in which we study the health of the female during pregnancy, during childbirth, and during postpartum period. So the second terminology is menarche. Menarche means the start of the menstruation is called menarche. The menstruation, which is mean the shedding of endometrium. Each month there is a loss of endometrium of uterus. Our condition is called menstruation. And the puberty it is the age at which the female or male become capable of reproduction. So it is normally 12 to 14 years. After 12 to 14 years, the female or male become capable of reproduction. In this age at which it become capable, this is called puberty. Menopause, end of menstrual cycle is called menopause. And abortion, it is a pregnancy termination either by removal or expulsion of the fetus or from the womb of the mother. This condition is called abortion, but the abortion is further divided into two. One is the miscarriage and the other is induced abortion. In miscarriage, there is no involvement of human, and it is naturally occurring. In induced abortion, there is involvement of human. For example, if a female take the misoprostol, she will be aborted because she taken the misoprostol. So it is the induced abortion. The other terminology is amenorrhea, in which there is no menstruation. The female in which there is no menstruation is called amenorrhea. And the other is cryptomenorrhea, in which there is menstruation, but the menstruation is unable because there is an outflow obstruction to the bleeding of uterus. It may be the imperforate hymen, or it may be due to vaginal septum. But I am not concerned with the causes of the problems. So the second, the other terminology is menorrhagia. Menorrhagia is also called heavy menstrual bleeding. When the bleeding is more than the normal, this condition is called menorrhagia. It may be due to cancer, it may be due to other causes. And the other is menorrhagia. Menorrhagia means intermenstrual bleeding. For example, if a female start bleeding from 2 to 5 days, and then the bleeding stop, and till from 5 days till the second cycle there is bleeding. This condition is called menorrhagia. And infertility, when a female or male become unable to reproduce, this condition is called infertility. And dyspareunia, it is the painful and difficult sexual intercourse, but the pain may we feel externally or feel internally. The other is dysmenorrhea, which is the painful menstruation, and the mastalgia, must mean breast, and algia mean pain. It is the breast pain. And dysuria, here you can see this is there is a terminology which is called dysuria, in which there is painful micturition. When there is a pain with micturition, this condition is called dysuria. Amenorrhea, it is the loss of amniotic fluid via vagina. It is the loss of amniotic fluid through vagina. This condition is called amenorrhea. The other is in ovulation, when the female become unable to ovulate, it is called in ovulation. And the dystocia, it is the difficult labor progress. In the multiparous, when a female have two or more pregnancy completed, this condition is called a multiparous, and the female is multiparous female. In nulliparous, when a female have no birth at all. This condition is called nulliparous. Macrosomia mean abnormally large newborn. When a newborn is abnormally large, this condition is called macrosomia. The other is telergia. It is the beginning of breast development. The beginning of breast development is called telergia. And the other is hematocolpos, which is the blood-filled dilated vagina, in which the menstrual blood fill the vagina. It may be, and the other is hematometria. Hema mean blood and metria mean uterus. It is the blood accumulation within the uterus. The other is puberche. It is the first growth of the pubic hair. So this was all about the terminology of the gyne. So thanks for watching the video and don't forget to subscribe, like and share.